Actually, I always go by the name Win. So those of you that would like to treat me like a friend, it's Win Horsley. Okay. Thinking about this and how to go about presenting the approach that we should have on health, something that actually is quite different from the world, I felt, how can I do it? I've done it before, but just this whole new setting, and I didn't know just what kind of direction to take. And I feel like the psalm that I was at in the morning gave me help. It says, "Oh God, my heart is fixed." And I do feel quite sure of all that I have here for you. But I want to go further down in this psalm, Psalm 108. Thy mercy is great above the heavens, thy truth reaches to the clouds. Be thou exalted, O God, above the heavens, and thy glory above all the earth. When you think of the way that health and healing is practiced, this verse near the end struck me. It says, who will bring me into the strong city? Who is going to bring us into the establishment of all the ways that are considered the best in this world? Who's going to bring us into that? Wilt not thou, O God, who hast cast us off? Sometimes it looks like the world has overcome the right way. Wilt not thou, O God, go forth with our hosts? Give us help from trouble, for vain is the help of man. Through God we shall do valiantly, for he it is that shall tread down our enemies. So whatever we feel are the obstacles, whatever might look like our enemies, as we seek God's help, he's going to see us through and give us not only strength, but victory. When we look at the issue of health, of course, everyone's concerned about health. It's, in terms of this life, that's what it's based on. You know, if a person loses health, nothing else of interest in this life is really worth much. So, the question is, which direction should we go in health? Now, we've got lots of science that's being put forward, lots of instruments of medicine, lots of fancy technology, and at the same time, in the world nowadays, you've got a strong movement toward a more natural approach to health. And that has its appeal. We can see reasons for that. But the question is, what really should be our sure guide in how to go about this? How do we choose the best way? In health, you could say that there are two aspects. They are very closely related, but you could say that there are two things that we can think about at the start. One is the issue of health for a person that's basically getting along. In other words, how should we live? What is the way that we should live to maintain good health? The second aspect is, what if we've lost good health? When a person's sick, how should we seek healing? And we'll get to both those, but what I want to do first of all this morning is start with that second aspect.
Can I give you this?
Okay.
Yeah. 'Cause when you walk away, it doesn't-
Oh, okay. If you want to have a voice to the world for what is God's plan of health, they're not going to, first of all, listen to inspired writings. What could we say to people in the world that would give us a clue as to which direction to take? And so what I want to do then is to take a look at what actually is happening. Yeah, those fellows are that's maybe a bit of an extreme example, but there's plenty of this going on, feasting most of the day. Here's what I wanted to start with. This ad, and you can't, I don't think you can't see the details down below, but the top line asks the question, how can we help, or states how we help granddads be granddads longer. In other words, how are we giving a longer life to the population, particularly the aging population? Now, when you look at the details of this ad, it's saying that the pharmaceutical industry is what's giving the longer life to people. Now, what it does is it starts from looking at 50 or 100 years ago, saying the average lifespan then was 40 to 50 years, 100 years ago. And as time has gone on, the lifespan has risen. So now it's 70 to 80, the average lifespan. And during that time, it is true, the drug companies have grown. There is now drugs for pretty near everything under the sun that you could have availments. And they're presenting the resulting increase in lifespan as due to the drug industry. You look at the bottom there, and it's actually a group of the drug companies that got together, pharmaceuticals, that presented this ad. So, of course, there's a self-interest there. But the question is then, is that actually true? It is true. Lifespan has increased in the last 100 years. And it's also true the use of drugs has increased tremendously during that same time span. And the question is the longer life a result of the use of the drugs? Well, when we look at the drugs, maybe I should mention one other thing. You know, it's a little bit of a trick in statistics. When one thing increases and another one does, it's easy to think maybe the one causes the other. You have to be careful about reasoning that way. One fellow presented the fact that when they look at grade school children, it turns out that the ones that have bigger shoes turn out to be the better spellers. Why would that be so? Unless you think of the fact that if you're talking about all the grades together, all the levels, then the ones with bigger shoes are the older ones, and it's not so mysterious. So here, the fact that drug companies have arisen and had a tremendous boom in prosperity, don't from that just automatically conclude that they're the result, they give the result of increased lifespan. Let's look at what you do with drugs. When we use a chemical, in fact, when we do any treatments, we're usually looking for an effect on our symptoms, the thing that's bothering us, why we feel sick. And the first of those to mention would probably be pain. So a person has a pain in a certain part of his body. A drug can be taken for the pain. Or a cough, like I just about have. You, of course, can take a drug for the cough, stop the coughing. Diarrhea, got misspelled there. Should have an H after that second R. You can take a drug that will slow down all aspects of digestion, and it'll stop diarrhea. A fever. There are drugs, of course, that stop fevers. Aspirin will do that. Now, we better take a look then at the symptom more closely. If a person has pain, that is a warning about a problem going on. You know, of course, we know there's pain when there's an injury, or it could be pain from a disease that really needs attention. You know, when a person has severe abdominal pain, goes to an emergency room, a careful doctor will generally not just immediately give them a pain pill, because the most important thing that needs to be done, first of all, is diagnose the cause of the pain. You give a strong pain pill, and you may wipe out important information that's needed to make the diagnosis and really treat the pain. The cough, that's a defense mechanism, and in fact, often it helps the person get rid of, helps fight the infection, or some undesirable substance in the throat, or something that's gotten into the lungs. With diarrhea, you can see that often the diarrhea is actually getting rid of something toxic that's in the digestive tract. And so just stopping the diarrhea really isn't accomplishing the goal. Let that diarrhea get rid of the toxic substance. And finally, a fever. A fever bothers us, of course, but we should keep in mind that the fever actually is getting the immune system active to fight, whether it's an infection or some other thing that's the problem. Oh, thank you. Okay. So, we want to keep in mind then that the symptoms really are just the signs, the indications that there are a disease, but they're often protective. And so if you get rid of the symptoms, you may be hurting the disease long term. You may be hurting the person, I should say. Now, I think most people are quite aware of the fact that drugs will generally have side effects, undesirable effects, not the effect that you are aiming for. So this little one here has gotten where she shouldn't, unscrewing some bottles with drugs in them. In the history of medicine, there are lots of examples of these undesirable effects from the drugs that you're using, hopefully, to treat a disease. This is an actual situation that happened back in 1982 in the United States. They did a study of men who were taking drugs for high blood pressure. was not a small study, 13,000 men. They checked them out over a period of 10 years, and they found out that during that time there was, as they quote there, an unexpectedly high death rate. The death rate among those that took the drugs compared with the ones that did not for that problem of high blood pressure, the death rate was 65% higher among those that took the drug. They probably got their blood pressure down significantly, which if that's your only goal, then you'd be satisfied. But a larger number were dead. Now, in U.S., a standard book that physicians use all the time is called the Physician's Desk Reference. I don't have an example here for you to look at, but it's about so thick, 3 or 4 inches, and it's on very thin paper, thinner than newsprint, and the typing in it is extremely small. It has something nowadays, or at least the one I'm showing there, had over 3,000, maybe 3,500 pages, and just jam-packed with information on the drugs. It's of interest that perhaps, I would say more than 20%, perhaps 30%, and sometimes up to nearly half of the information on each drug is about the dangers of them. Now, this isn't a completely objective source of information. What this is putting together what the drug companies themselves write about their drugs. It's a presentation that they're forced to make. The government demands that they do research on the drugs, and then this write-up is put together, all of the different drugs, it's put together into this book. Now, in medical school, one doesn't use this textbook. You have another more objective source of information on the drugs, and one of them is a textbook by Goodman and Gilman on the different families of drugs and the problems and how well they work for taking care of the diseases. And in the write-up there, they had I felt, a rather good presentation of the way drugs may have undesirable effects. The first of these undesirable effects is what they call toxic symptoms. These are things that happen soon after a drug is taken. A drug may cause a headache in a fair percentage of the patients, or there may be skin problems, a rash that comes out. Toxic symptoms usually are short-term, and often, but not always, they will clear when you stop taking the drug. That's the first of these side effects of drugs. The second one is what they called pathologic effects. These effects are damage to the actual system of the body that is more long-term. It actually causes a damage that could affect the person from then on. The third class of effects is that the drug may affect the person's genes. The reproductive system could be affected so that not just the person that takes the drug is affected, but rather the next generation will be affected. The term for this is teratogenic effects. And the drug companies have to comply with the demand that they check this out. Of course, it's done with animals. They'll check various doses and what it does over a few generations of animals. Of course, they can't do that with humans. And although we're similar in some ways, there are ways in which we're different from animals. Now, the first of those classes of side effects, the toxic symptoms, are going to be readily apparent. You know, if you take a group of people, as one has to do in presenting these drugs for approval, you're going to see the toxic symptoms right away. So those ones are known, and they are documented in the textbooks on the drugs. The genetic effects and even the pathologic effects that may take years to show up often are not known. There are a few cases where they have been seen, but often you can't expect that they will show themselves easily. One of the big problems is the drug is used, but if something happens a year later, how is a person going to connect that result with the fact that they took a drug, years before? It's not easy at all to make the relation. Well, if you think seriously about this, one sees how much of a problem this is. It's it's going to be difficult to do. We'll look at the side effects that are immediate, and that's not hard to see. I'm putting up the names here of 3 drugs. Actually, the first 2 are drugs. Xanax is a tranquilizer that's been used for a number of years. Acetaminophen, I'm not sure of the trade name here in Britain. In US, it's called Tylenol. And it's used as a mild pain reliever. And then contrast agents, really, you wouldn't call those drugs. These are agents that are put into the body so that they can diagnose a problem, whether it's blood vessels or bladder or other things. They'll show up in the x-rays much better than without the use of them. Do they have any side effects? And finally, one more drug there. Okay, Xanax then is for the treatment of anxiety and panic disorder. And you can see it has plenty of problems right away when a person takes it. In fact, occasionally in the person, it can give the very problem that it's supposed to treat, which is anxiety at the bottom of the list. But many people will get lightheadedness, feel like they could faint, impairs the memory. In fact, sometimes it's even used for that. If a person is going to be going through a procedure that they don't want to remember, they'll give them that. Irritability, fatigue, and so on. You can see a number of the side effects. Now, if the person takes this drug for a period of time, after a few days, they're going to have problems when you try to stop the drug. There's going to be withdrawal effects. And those can be quite severe. Not just lightheadedness, but cognitive, that is, thinking problems. They can't think straight, irritability, fatigue, and so on, headache, insomnia, and even abnormal, uncontrolled movements. Now, I want to get to that second one, acetaminophen, or with the trade name Tylenol in US. I'm sure it's here maybe with a different name. What's well known in medicine is when there are large doses, you damage the liver. It was a number of years ago, I heard a specialist working in pain clinics who said that they've seen that when they use this mild painkiller, in fact, it's considered so harmless that it's over the counter. You don't need a prescription to get it. And yet, she said they never use it, even for mild pain, in the pain clinic because of its danger. It's known that if you get, now this seems like a huge amount, 1,000 doses in a lifetime will double the risk of the person ending up with the kidneys not functioning. But people take this drug, not just one, but often 3, 4, or more doses a day for many months, years. So it's very easy to get to 1,000 doses. And if a person gets to that, the risk of ruining the kidneys is very definitely increased. Contrast agents for x-rays can certainly cause allergic reactions, but another bad thing is that if the person has any trouble with the kidneys beforehand, these contrast agents put into the bloodstream can quickly damage the kidneys further and really lead them to kidney failure, much worse than they had before they got the study. I want to look for a minute at an example of genetic damage that's going to affect the next generation. Some of you may remember a drug by the name of thalidomide. Okay, a few of you have maybe a few white hairs like I'm full of, and you'll remember that. This was back in the 60s. They were using it as, innocently, without any idea of what was going to happen with it. And mothers that took this drug when they were pregnant, it ended up causing severe changes in the limbs of the baby, very short limbs. I remember when I was in my residency, training for my specialty, one of the fellows that worked in the prosthesis department was rather short. His trunk was big, but his legs were just abnormally short, and both his arms were even more impressively short. One of them was about so long from his shoulder. It looked like a clear case of the results, just what this drug would give, thalidomide. Now, in that case, in the case of thalidomide, after a few months of use, as this result in the babies became apparent, of course, they then stopped the use of it. It was clear enough. They could relate the drug to its result fairly easily. This next one is different. This one has the name diethylstilbestrol. It's actually a female hormone, but not one that's actually produced by the body. It's synthetic, and its structure chemically is a bit different from the hormones, the normal female hormones. But it does have female hormone effects. Well, this was used for a number of years. And as time went on, they saw a new cancer that was occurring. It was in young women after they'd gone through puberty, but it took time after puberty. It was the young women in their 20s. Some developed what's called a clear cell adenocarcinoma of the vagina. These young women that had this cancer, they were with difficulty able to show, as they went back in medical records, that these young women were embryos. They were the girls that the mother was pregnant with when she took this female hormone. Well, what I want to point out about this is the difficulty of relating the result with the cause. 20 years later, just if there weren't medical records that had been kept, you wouldn't find out. Often the person may have forgotten what they were taking. Now, both of those drugs are among the few that one has determined, it's been found that there was a genetic problem that caused an effect on the next generation. Both those were discovered because the effect was so dramatic. In thalidomide, what we just discussed, and in this diethylstilbestrol, cancer and death, of course, catches your attention. What if the effect on the next generation weren't something that's so obvious as cancer and death? What one would have to conclude is we really don't know what we're doing with the drugs that are being used. Evidence like this forces us to say, let's take a halt. We're not going to do all the rest of what we have here. We really need to stop and reconsider the whole picture of how are we going to go about healing. Well, I'd like to take a few minutes now to demonstrate a very simple way of approaching a problem that is so very common, headaches. Instead of using drugs, we're going to think for a minute about what causes most headaches. I think everyone's heard of migraine headaches. Migraines, and actually more than migraines, are generally accompanied, and often the pain is caused by congestion of blood in the head. The blood vessels dilate, they get bigger, and this causes pain. Now, many people know that it can be helpful when you have a headache to put a cool rag, something that's been dipped in cold water, put it on your head. I'd like to show an added feature to treatment that can really help make it a much more effective treatment. I don't know if I have a volunteer. Is Mandy here? Are you here? Okay, good. We're going to just make a dry presentation of what really is hydrotherapy using water. Okay, take a seat.
Do you want to come over there? Because you're
Okay, yeah, we need this. Okay.
Your pulpit.
What was that?
So if you come over this way, the pulpit will be in the way of
Okay.
the audience.
Good. Let's have you just sit here and I'll see, because they'll need to see this under your feet. So we're going to say that Mandy has a bad headache. She's wanting to know what can be done. Pills are around, of course, but she would like something that fits with the body's functioning better. Okay, well, I'm going to start with what everybody knows. We'll say that this is filled with water and ice. We'll put the rag in, stop it from dripping with just gentle squeezing, but leave lots of water in it. And we'll put this up here on your head and hold it around. 5 minutes is all. Okay. Now here we've got a bowl with some quite warm water. And we're going to put the feet in the bowl of warm water. Now, if we were going to make this an even more effective treatment, I didn't do it, but one could take a sheet or a blanket and wrap the person in the blanket, the sheet, and so the whole body would be warmed up. With just the feet, it often will work enough. What we're doing here is applying heat to the feet, and where you have heat, it generally causes the blood vessels to increase in size. You're going to be bringing blood, drawing blood to the feet. And as it does this, it takes, of course, that blood has to come from the rest of the body. And the interesting thing is, it generally takes that blood from where there's excessive congestion, just what we want. So the excessive blood in the head is going to be drawn to the feet. The cold to the head does help the blood vessels there to constrict, but adding the effect of the warm water to the feet really magnifies it and makes it better. As you go ahead with this treatment, it's over a period of several minutes. The water will get cool, and so we add more hot water. This will be quite hot water. We add it in and make sure that it goes by my hand. I'm checking with my hand so you don't burn the patient. And this hot foot bath is not hard to do. You've got simple things: a bowl, a rag for the head, ice water, a pitcher full of hot water, and if you want to include the whole body, use a sheet with it. Okay, just before finishing, after 10, 20 minutes of treatment, we'll lift the feet out and we'll put, let's get this right under the feet. We'll pour the cold water over the feet. Now you think that might be counterproductive, but no, it actually is quite helpful. It's, aside from being stimulating to the blood flow. Okay, now we'll get your feet here and dry them. Okay. Thank you very much, Mandy. This simple approach I demonstrate, hoping that you'll keep this in mind for the next time there is a headache. It's something that is quite effective. Well, the Lord has given us many ways of handling health problems that fit with the functioning of our body, instead of introducing chemicals that are foreign to our body and often damaging. And over the next few days, I hope to talk with you about them. May the Lord bless you all.